Hi, Be Health Empowered family, and welcome back to another episode of Excuse Me, Doctor. We're so glad that you could join us this week. Happy summer to everybody. That kicked off officially last week. And, we're having heat waves across the country. So I hope everybody is keeping well hydrated. But summer is my favorite season. So I'm just happy that it's here. And, you know, every week we are here on Excuse Me, Doctor to bring you health topics based on science and real evidence. So you can be confident and empowered to make the decisions for you, your family, and your community when it comes to your health. We bring focus to speculation, clear up misinformation, and we debunk disinformation. We're here every Monday night, 9 o'clock Eastern, 6 p.m. Pacific. We're streaming on YouTube and Facebook. And so if you're joining us for the first time, welcome to all the newbies. Please remember to hit like on Facebook. And if you're on YouTube, please hit subscribe. So, we have a fantastic show for you. And just to kind of let you know what it's about. So Run DMC, The Rock, Charlemagne the God, Wayne Brady, wide receiver Brandon Marshall, what do they all have in common? They have shared their journey about depression and seeking help for depression. So as we close out Men's Health Month, June was Men's Health Month, we are going to be doing that same thing tonight, talking about the mental health for men with a focus on African American men. And we have a wonderful, knowledgeable, and passionate guest, Mr. Mark Harrison, who is a Black men's mental health advocate. And he's going to talk with us about removing the stigma around mental health for men in general and practical advice about how to recognize depression and get help when it's needed. So please share this episode with all the brothers with your boys, your uncles, your cousins, your brothers, and all the women who love them. Anybody who this is going to be a really important, Excuse Me, Doctor, one that's not to be missed. And also remember, please start writing your questions in the comments because we're going to be getting to them in first come, first serve order. So we want to make sure we hit all of them. So start getting them in now. And as always, I would love to welcome my two wonderful co-producers, Miss Lila Mays and Mr. Wayne Bruce.
Hey.
You're on good mute. To see you guys.
Somebody muted themselves. there you go.
All right. Yeah, we got to hear that wonderful laugh. Hey, Lila.
Hey.
How you guys doing tonight?
We're good.
Good. How you?
It has been a night already. We started off. I'm just letting you know. I just started off with the comments, and I had to delete somebody, block a user already. What kind of night? Well, is it a full moon?
Let him on in here. Let him on in
here. So we have to get to our weekly recap, though. I mean, we can't let that hold us up.
Yeah, so let's go to the recap.
All right. So, we always start off with the numbers. And as of today, we've had 33,437,000 cases of COVID-19 to date in the United States. Wow. That's 1 in 9 Americans have tested positive for COVID. And we had 80,000 new cases since last week. And then, of course, we also talk about the souls that we've lost to COVID-19, 601,221. And we've had 307 deaths, just in the last week. Thankfully, those cases and deaths are going down, and the deaths primarily to vaccination, and also I have to take my hat off to my healthcare colleagues who now have fantastic years worth of experience of treating COVID and many new treatments that are being brought to bear. So huge factor in that.
That's awesome that,
That's awesome.
the numbers are not as bad as they were in terms of the death toll. Let's get to some Vax facts, Dr. Mill.
Yeah, so we are at 66% of US adults who are vaccinated or actually who've gotten one dose. 57% are fully vaccinated, which means that unvaccinated people are what? Now in the minority. And I think that's going to turn out to be pretty important in terms of like a tipping point. So, as people start to hold parties and insist that their guests can only attend if vaccinated, travel and employment become easier for those people that are vaccinated, I think that's going to make a difference.
Okay. Interesting. So, all right. So, good news, bad news, though, in terms of vaccines and vaccinations. What we got?
Well, before we get to the good news, I guess the good news is this. We have a reliable way to prevent just about every death from COVID-19, and that's the vaccination.
Wow.
The bad news, that's the good news. The bad news is that not everybody is taking advantage of it. So I told you about that 57% of Americans, adults, are fully vaccinated. In some communities, especially among Black people under 40 and Trump evangelicals, Republicans, vaccination rates are much lower. So, for example, among Asians, the full vaccination rate, 60% of all Asians. Wow. For whites, it's 40. Yeah, that's great. For whites, it's about 46%. For Hispanics, about 38%. And for African Americans, it's about 33%. So unfortunately, we're kind of trailing along in the back.
Let me tell you Black people something, okay? So look, I was in the grocery store yesterday, and I live in the community, and they done ripped up all the 6 feet signs and, no socially distanced, but 33% vaccinated. Put the 6 feet signs back down until y'all get fully vaccinated and keep your mask on. Okay, that's Lila. My views and opinions do not necessarily represent those of the doctor and the other producer.
They represent my opinion. I'm sorry. Put your daggone mask. I can't even say what I want to say.
And stay away.
Put your mask back on, man.
But you know what, though? You all are not too far off, because the WHO worldwide has said that even vaccinated people in public should continue to wear masks. And that's primarily because of the Delta variant, because it's more transmissible. So even though it's not making vaccinated people sick, it is definitely infecting them so that they can pass it on to unvaccinated people or, people who are vulnerable. And so there's still a lot to be said in public places like grocery stores to still be having, the 6 foot markers down. Sorry, they ripped them up in your grocery store, Lila. and wearing the masks. Those are still very important. And, the Delta variant is causing 20% of new cases in the United States. And it's doubled in just 2 weeks. It was causing just 10% 2 weeks ago. And so it's really important because they think that by the end of July, the Delta variant will be like almost 100% of the cases. And we know that it's making people sicker. We know that it's easier to catch. And so it's, I think we're opening up prematurely, to be honest with you. At least the message is getting out there that nobody needs masks when it really is just vaccinated people.
Right.
So,
all right.
So that's the good news, bad news.
Well, let's talk about what actually COVID did for us in those times. It had us on lockdown. And a lot of times people put on the COVID-15 during COVID-19, And so, but not only adults, young people did too, because they couldn't go outside. So so that brought on a lot of health challenges for not only adults, but young people. You want to talk about that, Dr. Mel?
Yeah. So a hospital in Baton Rouge, Louisiana, looked at this issue. They compared children and the rate at which they were getting diagnosed for diabetes type 2, which is the one that's related to overweight and obesity and how that changed from 2019 to 2020. It turns out that the hospitalization rate for the new onset of newly diagnosed diabetes in children rose 2 to 3 times in 2020 compared to 2019. And nationwide, we're actually seeing a similar trend because kids' BMIs, body mass index or weight, is going up. And it's likely due to the decreased physical activity, worsening diet, stress eating, just like it's been for adults. And, I'm saying now that it's summertime, it's really important to get our kids back outside. If they're 12 and up, time to get them vaccinated so they can go to camp, so they can play with their friends. And even if they're under 12 and can't get vaccinated, to make sure that they're wearing masks, physically distancing, but being outside, going on hikes, going on walks, being active as much as possible.
Yep. Get moving.
We got to get them, as in our former first lady would say, keep them moving, right? Get moving.
Yes.
That's right. Keep it moving. Yeah. That's right.
All right. So this is super important to me, with some scares in the family. But why, Dr. Mill, do Black women die more from breast cancer, and what can we do about it?
Yeah, it's I have had my roommate actually from medical school died at 38 of breast cancer, brilliant African-American woman dermatologist. And even though white women get breast cancer more often, Black women are 40% more likely to die from breast cancer. And that's because Black women get diagnosed later in the disease and tend to have more aggressive types of cancer that spread more rapidly beyond the breast. And so they're harder to treat once they're found. And so I would say to every Black woman, definitely abide by mammogram screening recommendations of starting to get your mammograms at age 40. And things to do to lower your breast cancer risk. We just talked about being physically active. Actually, that works to help prevent breast cancer risk. Eating fruits, 5 servings of fruits and vegetables a day, 7 if you can get them in. Do something every day to de-stress, because stress accelerates every disease process. So even if it's yoga or meditation or dancing, whatever it is, do something every day to de-stress. Alcohol. A lot of people don't realize that alcohol is tied to increased rates of breast cancer, and so is smoking. So definitely stop smoking and limit your alcohol intake. I mentioned the mammograms. If you have risk factors, starting at age 40 to get your mammograms, talk with your doctor about what the age is and how often you should be getting them.
Thanks, Dr. Mill. Shout out to my mom who's in the audience, who is cancer-free as of today.
Fantastic.
All right, Miss Mays. Hey, Mom. That's wonderful. Hey, Mom.
Wow, that brings us.
That's wonderful.
That's wonderful news. But that brings us also to a subject that I'm very interested in. As you could tell tonight, I'm not wearing any makeup, and sometimes my concealer doesn't. I'm worried about my concealer. Mac had a give back program. You turn in 5 and you get a free lipstick. Sometimes,
what you know about that?
Watch your ministry now. Watch your ministry. You don't know what goes on, how I keep it looking so fresh and young. So I know a lot of our audience is concerned about the PFAs. They heard about the news about the PFAs in cosmetics. Can you explain that to our audience, Dr. Mill?
I can. I find it ironic that everybody's concerned about what's in the COVID vaccine, but something that we use every day, like cosmetics, turns out to have these nasty chemicals in them called PFAs. And these PFAs are actually used to waterproof and increase the shelf life of cosmetics. So they're found in over 80% of waterproof mascaras and 60% of lipsticks and foundations. Overall, half the products tested in this one study that were cosmetics had these PFAs. Now, what's the big deal about them? They don't break down in your body, and so the levels can build up, and high levels are associated with cancer, liver damage, reduced fertility, asthma, and thyroid disease. Um, and then the other thing is we're putting them near our eyes and our lips so they get absorbed into our body more readily. So there's a new bill in Congress to ban these substances altogether. But until then, it's really important for us to be conscious of what we're putting on our faces. Google the cosmetic line that you use to see if they, have PFAs in it, or just look for PFA-free cosmetics online, because actually a lot of times it's not even labeled as to whether they're in them or not.
I'm sorry. You said something that came to my attention in there. You said that these PFAs could cause sterility. Did you say sterility?
Reduced fertility.
Reduce fertility in your cosmetics. But you're worried about the COVID vaccine and reduce fertility that's not proven anywhere. But you're going to put your makeup on and go in to work. I'm just saying, I think we got our priorities mixed up.
Yeah,
I think it's misinformation. Let me say that.
Yes, it is about the COVID vaccine. It's not about the cosmetics, but it's important to be vigilant across the board about what you expose your body to.
I just also want to say Wayne Bruce comments are not necessarily those of the program and Dr. Mel's. I'm sorry. Come forward.
Thank you, Wayne. Thank you.
I'm just saying, we need to get out of this segment right now.
Yes.
What is the official name of PFAs? Is it just PFAs?
No. They're polyfluoroalkyl substances or perfluoroalkyl substances.
She's so smart, y'all. She's so smart.
I just didn't want to burn y'all with all that detail.
I'm just saying.
She gave it to us as PFA
because we couldn't handle that. Somebody said, I just want to let you know it's off the chain in the comments already. Somebody said Wayne Bruce just needs to stick to his normal Vaseline.
Okay.
Okay, well, moving on. We have a whole nother segment coming up.
Let's go to our next segment. The weekly debunk.
Stopping misinformation in its tracks.
And this one comes from Terry Twitter Fingers. You don't know what drugs I got up in me. How do you know the vaccine ain't going to interact with one of them drugs? How, Sway? How?
Terry, let's ask Dr. Mel. Dr. Mel, what we gonna tell Terry?
Well, I have to say, first of all, I want to give props to one of our really loyal listeners, Yvonne, for who's been on the ground talking to people in communities in DC who have this very concern, right? And so she highlighted this for us. And this, I think, is a concern of people who might be on prescription drugs, as well as people who are on non-prescription drugs that they might purchase on the street. So, I've worked a lot in my career with lots of people who use opioids, both in the emergency department, as an emergency physician, and in an office setting. And I know that one of their concerns might be that since this COVID vaccine is a shot, which is similar to how Narcan is given, which reverses your high, that it might somehow interrupt their high. There's no need to worry, though, that there's no actual basis for this concern. The contents of the vaccine are very simple. It has the blueprint for how to make the spike protein of the coronavirus, specifically so your immune system can recognize it. And then the only other thing it has is a fat droplet in which that sort of coats that blueprint information. And added to that fat droplet is sugar and salt to basically keep it stable. That's it. So there's really no basis for that to interact with any drugs, medication, prescribed or otherwise, that are in your system. Also, what it does, again, is it puts your immune system on alert specifically for for the coronavirus, should you come in touch with it. So it has no effect on how your body processes medications, alcohol, or street drugs. Now, this is the kicker. People who use alcohol and street drugs may be at higher risk for COVID if they're using them in group settings, um, sharing joints, for example. And if you're high, you might not be paying attention to mask wearing, hand washing, and social distancing. And you also might not be focused on the things that keep your immune system at its highest and best, which is proper rest, nutrition, hydration, the things that keep your immune system functioning well. So, for all those reasons, if you actually are on medications, whether they're from the street or from your doctor, that should be a reason to actually get any available COVID vaccination as soon as possible and not a reason to avoid getting it. So I hope that clears up that particular concern.
I hope it does too. And that's our weekly debunk this week.
Yeah.
That is our weekly debunk.
Yeah.
Thank you, Terry, and thank you, Yvonne.
Yes, thank you. And remember, everybody, be sure to like, comment, subscribe to the YouTube channel.
Mm-hmm.
And if you're not already following Dr. Mill on Instagram, look her up.
You gotta follow Dr. Mill on Instagram.
I'm there.
And look, our viewers can attest that sometimes we have contests, and Dr. Mill has a book. You know, I'm quite sure everybody's familiar with the book, right? If you're not, bang, there it is. It's called "Excuse Me, Doctor, I've Got What?"
Wait a minute, you got to say it with an attitude, though. Excuse me, doctor, I've got what?
Excuse me, doctor, I got what? So look, she tells you how to navigate the healthcare system once you get a diagnosis. So that's important. But it's our time to get out of here, and we'll be back, right? We'll be back.
Thank you. You will definitely be back.
All right.
And thank you very much, Lila and Wayne, because we are ready to move into our topic for tonight. According to the World Health Organization, 1 in 4 people in the world live with mental health conditions. And this is probably a gross underestimate because the majority of us at some point in time may undergo a prolonged period of anxiety or depression, and especially after the 15 months that we have just been through. Mental health is arguably the worst pandemic that the world has ever faced. Furthermore, because of the related stigma, 2 out of 3 people who are affected with a mental health condition won't seek help or don't seek help. So, as I mentioned before, this is Men's Health Month. And so we at Excuse Me Doctor thought it would be a great time to shine the spotlight on men's mental health, especially men of color. And because on top of all the other stressors in life, they also have to contend with racism and discrimination. So in addition, the way that men are socialized might not lend itself to seeking help when faced with challenges to their mental health. So to walk us through this discussion, we have a fantastic guest, Mr. Mark Harrison, who's a Black mental health advocate, and he's founder of Saving Our Kings, which is a resource and safe space for Black men to come together. So I would love to welcome him. Thank you so much for being here, Mark, to join us on Excuse Me, Doctor.
Hey, good evening. Good evening. It's an honor.
So why don't we just start off with, tell us about what is Saving Our Kings?
Saving Our Kings was actually created around mental health for Black men. Black men are kings. My goal was to save lives by having those safe discussions around mental health. So one night I was sleeping, it just came to me. Hey, I want to save our kings. Boom, there it is, Saving Our Kings. It was nothing that was elaborate. It was nothing where I had to go do a whole lot of research, and it just came to me in the middle of the night, and I just kind of ran with it.
That's when I think most brilliant ideas come, when you are at peace and just relaxed. That's when they pop into your head. So what drew you to this mission?
Wow, that's a good question. I had a good friend several years ago. It was probably right before COVID, who was dealing with depression. And I'll be honest, I didn't know what depression was. In my mind or on the street, he got issues. He's crazy. I don't have time to be dealing with that nonsense back and forth. But he was struggling, and struggling like I had never seen before. 2, 3, or 4 o'clock in the morning, I'm up talking to him, trying to talk him off that ledge. But one particular day, he called me around 4 o'clock, and you can just tell it was just something a little bit different. And I'm talking to him. I'm even getting in the shower, taking my cell phone in the shower, having these conversations. And he asked me, well, why are you doing this? And it was simple for me. I just said, I love you. And when I said, I love you, it was kind of, he just broke down even more than he was breaking down before. I said, I'm on my way to work. Let me call you when I get to work. 11:42 that afternoon, I got a call from his girlfriend saying that he had killed himself in his daughter's room.
Oh, God.
And
Wow.
my supervisor at the time was a psychiatrist, so she understood. And she just sent me home, and here I am doing that blame. Is there anything I could have said? Is there anything that I could have done to help him?
Right.
And I put more weight on top of me. So at his funeral, I'm speaking, and I would say 95% of the men in the room were crying. And I'm like, something is going on here, and I didn't have any clue what it was. So for me, the stigma, not realizing that I had my own issues, I'm in the gym just talking about, brothers in depression, brothers just dealing with all types of things in the world. And my homeboy said, well, I tried to kill myself 3 times. And I said, okay,
Wow.
God, what are you trying to tell me? This guy's actually on the radio, so you hear him every day in the morning. And I'm like, what are you trying to tell me? What is it that you want me to do? And I just started talking to my friends, and they said, well, God's giving you that voice to say that you need to go out there and start speaking. And that's actually what I started to do. And I didn't realize when I was speaking, I would say 98% of the men would send me DMs because they didn't want the world to know that they were suffering. The women were right there immediately talking. I see it in my son, I see it in my husband, I see it in my brother. But the men were like, yo, bro, I'm going through the same thing. How do you deal with this? And I was like, wow, here it is, the stigma again, where men had to be so macho that they didn't want to share their journey of suffering in silence.
Right. Wow, that is such a powerful story, and my heart goes out to you and to the family of your friend who killed himself. I think one of the things that you said, people were DMing you because they didn't want anyone to know that they were going through that struggle, but women were more vocal in identifying it. Can you talk to me a little bit about maybe one of the things I mentioned is men are socialized differently. How do you think depression shows up differently in men than it does in women?
Men are always macho. We got to hear that. I'm tough. I have that hard exterior. But when we go into a situation where we start to pull back and we become very reserved, we have to notice that there's something actually going on. For me, I tell people right now, the whole time I'm helping people, I was dealing with my own demons, and I didn't know what was going on. I went into a deep, dark depression to where at this time COVID had kicked in. And while COVID had kicked in, I ended up going through a stage 2 prostate cancer. So I'm trying to deal with my mental health, but I'm also trying to deal with cancer, but I'm also trying to be that man. I can do it. Let me be strong. I can't let the world see me weak. But I was crying inside. So what I started to do, and it's something that you said earlier, which was kind of ironic when you talked about opioids. So for me, opioids became my go-to drug along with alcohol of how I can actually deal with covering up my own mental illness, but also just fighting the demons that I have inside of me, not even going to counseling. I was still at that stigma. I'm not going to go to counseling. I'm going to deal with it my way. But something happened. I saw a friend who saw a shift in me. And it's weird. It wasn't one of my boys. It was a female. My boys are like, I always see you as being strong, the go-to person. So to see me weak, they didn't know what to do. But come to find out, my weakness was also hindering their mental illness as well. So that's when I really started to talk about it a whole lot more. But again, I'm talking about it, but nobody knew that I was dealing with my own demons. And I waited probably a year later to say, hey, I need help. I'm having these discussions, but I'm not practicing what I'm preaching. So I waited a year later to go get help, to go seek that therapy. And it has been tremendous. I would say it has been hard, but it has certainly been one of the best decisions that I made. And for me in particular, I knew what kind of therapist I wanted and didn't want. So
well, before we get into the therapy though, I wanted just to highlight one of the things that you said, that it was a woman that recognized the signs in you. And I wanted to point out that I know sometimes for men, again, depression doesn't necessarily manifest itself as sadness. So if you as a woman have a man in your life, your son, your uncle, your husband, your father, it might be that they become more irritable. It might be that they become more angry. It might be that because they become more aggressive, or it might be a physical ailment. It might be digestive problems or sleep problems. So it might not be sort of the characteristic, oh, I'm sad kind of thing that many people equate depression with, because it could be other kinds of behavior change. And then you also mentioned too, alcohol and opioids as something that you turn to as well, right?
Yes.
Yeah.
Yes. Yeah.
And sometimes that can worsen the problem. Did you find that at first it helped and then over time it made it worse?
Yeah, it made it real bad. And it got real bad. My sad times were by myself. And that's the worst time, always at night.
Yeah.
When I'm by myself. In the daytime when people could see me, I was still that go-getter. There was a little bit of aggression, but you really had to know me to see it. But it made it worse. And the opioids, it was a unrealistic attempt of me killing myself, and I didn't know that.
Wow.
But I knew it got real bad when a friend was at my house, and they carry a gun, and by law they're supposed to, police. And I always say, don't bring a gun into my house. But this particular day, they did. And I was in a deep, dark space that day. Because I said, do not bring, and he brought the gun in the house and I saw it. And I said, yo, you got to take the gun out. So what he did was he laid the gun down on my table. Wow. And at this time, I'm thinking, I'm going to walk over to this gun and use it. And in my mind, that's what I started to do. And what happened was the phone rang. And it scared me. And it stopped me from going over there. But I was probably a couple feet away from that gun, not realizing that I definitely need help. Yes.
Wow. Thank God for that phone call, huh? Whoever that was from, that was clearly was some kind of divine intervention.
Yeah. And it was a robocall of all things. But
I guess they do. I guess they do have their use.
Right. Yeah. But I go to therapy every 2 weeks now. When I used to speak about it before, I would say last year, coming out of COVID, I would go into a level of anxiety. Like, I can't do this. I don't want to do this. Am I going to break down having these discussions? This year, when I have conversations around mental health, it's so easy. It's therapy for me, and it's therapy for other men, women, and children who are now listening to it. So Saving Our Kings is also about saving the young men. Realizing that trauma starts when you're young,
Yes.
And I realized my trauma began as a kid, but I suppressed it, And I learned that sometimes I'm watching something on TV, something as simple as a mother hugging your child would take me into a whole different mental state.
Wow.
And that came out in therapy.
Yeah, absolutely. We had a show actually about Black maternal mortality, and you might say, well, why am I bringing up that now? And it's because it's been shown that adverse childhood events, so the traumas that we go through in childhood, just like you're mentioning, if they're not processed, they can lead to serious health issues, both maternal mortality issues, that women have around childbirth, but other things like high blood pressure, diabetes, and definitely depression. And so thank you for highlighting that, because a lot of people don't realize the need to actually process the things that happen to us in childhood. So how has that been working when you made that realization?
It's been great because I got it out. Like I said before, it was suppressed and I didn't know what was going on. That's probably it's not probably, it's one of the reasons why I was so angry a lot, because I had all those suppressed feelings and emotions inside of me. But once I got it out through my therapist, it was like I started to sleep so much better at night. I was like, wow, what's going on? I'm sleeping like a baby all over again. And it felt good. And it was like I let those emotions go. But I also learned too that I'm not in this journey by myself. There are so many Black men who have gone through the same trauma that I've gone through. But me just sharing that story and creating a safe space has allowed them to really open up, to share their journey as well. And it's been a wonderful thing for me. Like a couple of weeks ago, I did something with a couple of my friends on their podcast. And we were talking, and they asked me what I wanted to do. Now, mind you, this is their show. And I said, I wanted to do something on Black men in the abandonment of fathers. And the reason why I did that was in college, and most Black men remember this. They remember the Will Smith episode when Will Smith's dad came.
On Fresh Prince.
Yes. And we did it, and the producers actually put segments of that episode in it. In the reviews. This time, what was different this time, there were no DMs. They were straight messages from Black men.
Wow. I think so many men might identify with what you're saying right now and not even realize sometimes that those unprocessed issues from childhood actually, let's even put the physical health effects aside, they actually can play out in your work life, in your relationship life, in with your significant other, with your kids, in many different ways, right? I'm sure you explored that during that show as well.
Right. I have always wondered why certain relationships didn't work out. And I realized it was me not understanding who Mark was and dealing with those emotions that were suppressed. Because there's many times I said to my therapist, man, I didn't want to talk about this today. I came in with a mindset of this is what we're going to talk about.
Yeah.
And the whole therapy session changed. And the part that scared me in therapy was when he said, let's go back to the beginning. And I'm like, go back to the beginning. I'm 50 years old. Let's talk about what happened last week. You want to go back to where it all started. But then doing that, I realized what he was doing later on. And I said, wow, I didn't want to do that, but I am so glad that we did.
Yes, absolutely. And, you mentioned going to therapy, and, I'm so glad that you made that step. But, for a lot of men and even some women, they're like, well, I don't need a therapist, or, I can't talk to somebody about my deepest issues. What was it that got you realizing, number one, that you needed it, and that was the best course of action to pursue for you?
It was easy. I was tired.
Okay.
Yeah. I was tired of being in that dark space. I was tired of feeling empty. I was just tired of struggling. And I'm not talking about struggle in a monetary way. I was just I was struggling about who am I? What's going on? Why do I still have all these pent up emotions? I got tired. And that's what really made me go. Yeah, I've seen many celebrities talk about their struggles with mental health, and I applaud them. But I'm not a celebrity. I'm just that everyday average person. But I saw that their struggle was the same as mine. And I just woke up one day and I said, yo, I'm tired, but what I tell people is therapy is for you. No one has to know that you're going to therapy, and that's part of the problem.
Right.
We live in a society where we have to put everything on social media.
Yeah.
Who needs to know that you're going to therapy but you? And that's what I did. I just made the decision.
Unless you want them to know, right?
Exactly. But we're in a society where we have to post and share everything. When I decided to go to therapy, it was a year later after me doing the whole mental health piece. And I tell people I go, but I'm going for me. I'm not going for anybody else.
Yeah.
And if you're talking about me going to therapy, 9 times out of 10, you need to be in therapy yourself.
Right. Wow, those are wonderful things. I have all these other questions to ask you, but I just realized we need to bring back Lila and Wayne so that they can give us some of the questions that are happening in the chat right now. So come on back, Lila and Wayne.
Wow. Well,
I'm gonna let Wayne get to some questions, but before we do that, I want to go back to something Mark said that resonated so much with me. Anyone who's ever gone to therapy at all has walked into the therapist's office and said, I didn't come here to talk about that. But that's the very thing that you need to talk about. I wasn't planning on talking about that today. Yeah, that's the thing.
And this is true. This is true. I've been in therapy. That is so true. Absolutely.
Yeah. I mean, first of all, Mark, I want to thank you. As a man, I want to thank you, and a brother, I want to thank you for being, and our audience is saying the same thing. We thank you for being vulnerable enough to come on and share, so everybody can get help. I mean, because at the root of it, that has been your charge. You have been charged with that. So whether you, as I see it, so I thank you, man to man, fraternity brother to fraternity brother. I thank you. Nobody had to know, but I wanted people to know. But in the chat, let me bring in. We have a question, and maybe for either one, from Max Gregory Anderson. How does one find a good therapist, and what do we look for in a good therapist?
Great question. Thank you, Max. Why don't you take that, Mark?
I'll share my journey. I was very specific in who I wanted as a therapist. I did not want a woman. The reason why, nor did I want a white man or a white woman. The reason why I say that is I knew that my trigger was my mother. So I didn't want anything that was going to look like or sound like my mother. I wanted an older Black man who has walked this world, who understood what was going on in his world, but was also going to give me that father, grandfather type of, I would say, tongue lashing, and he does. And I like it. But even searching for my therapist and going through it, the first person I broke down to was a woman. And I was pissed. Like, this woman had me crying. I mean, the ugly cry, like Oprah says, on the phone. I was pissed. But I got it out. And I said, see, this is why I didn't want a woman, because she reminded me of what I didn't want to do, but she was helpful. But I still stuck with me wanting that Black man of a particular age. And young men have come, I'm not going to say men in their 40s who are therapists and say, oh, I would like to be your therapist. And I shut them down immediately. I say, there is nothing that you can say or do for me. And I end up getting a therapist. But also, I'm a veteran, so it was more easier for me to get a therapist versus somebody else. Because even looking for, when they say there's a 6-week wait, 8-week wait, and no, that's unexcusable. If I need help right now, you're going to help me right now, and you're going to find somebody. I became so aggressive with it that the very next day I had a therapist. And if I don't get on a telehealth, he will call me on my personal phone and say, hey, Mark, what's going on? Or the CEO will call me and say, hey, you missed one today. And that's what I needed. And it's good. And I used to go every week, but now I'm every 2 weeks. Because before I used to be like, I used to shut it down. Okay, I got to go to therapy. Whatever you're saying and talking about, I don't care. I got to go to therapy. But I was in the beginning.
Yeah. So go ahead, Dr. Mill.
Okay, we got a freeze on Dr. Mill.
I want to piggyback on that. And I know I love that we're talking about this, particularly for our brothers. And Mark, you keep dropping these nuggets that I think are just amazing.
I'm just speaking.
Listen, it's so important to be intentional about the kind of therapist you're looking
You bet.
for. And for me, hey, Dr. Mel, for me,
Yeah,
I've had a few.
we lost
I've
it.
had a few for very specific circumstances in my life, and I was very intentional. Okay, and this while I'm navigating this, I want a Black woman. While I'm navigating this, I want an older white man who isn't colored through my lens necessarily. I
Right.
think it's super important. And we are going to drop some resources in the chat. We're not going to
Mhm.
leave you all without some resources,
Right.
but my HR hat is on a little bit too. And so a lot of times your employer will offer employee assistance, which is completely confidential. They don't know who you're talking to, what you're talking about. It's an amazing resource. Check in with your employers if they offer something like that. A lot of times those programs will give you 8 sessions, and then you can go on to through paying out of pocket or with your health insurance.
Right.
Thank you so much, Lila, for picking that up. And I heard the wonderful points that you made. I also want to mention too that with the Affordable Care Act, Medicaid, Medicare, and any insurance that you have is obligated to cover mental health services.
Mhm.
So that should not be a barrier in terms of the cost and in terms of also looking, trying to find somebody who's, if you want somebody who looks like you, I think we just had the Boris Henson Foundation.
Right.
There's a finder in there where you can put your zip code and find professionals who are near you or in your area.
I would like to go back to, if we can, Dr. Mel, if we can go back into the chat. And I have a question, and comes from Michelle Walker Scales. How would you suggest talking to someone about seeking mental health therapy, especially if they're resistant or don't think there's a problem?
Great question.
Yeah, great question. What are your thoughts on that, Mark?
You can't make anybody go, but you can suggest. And that's what I've done to a lot of people. It's creating that safe space. Most people want to see that you're vulnerable. And we just have those open discussions. But I always tell my boys, you cannot heal what you don't reveal. And that comes from my favorite artist, Jay-Z, and I quote it to Black men all the time. If you're going through something, there are resources. But again, we're thinking, if I talk, the judgment of my wife or significant other, the judgment of my boys. And I always say, remember, you're going for yourself. And I'm to the point where one of my friends, they're married and they want to have kids. And I said to them last week, before you have kids, make sure both of y'all go to therapy.
Yeah.
And I just came straight out with it. And they agreed. So it's really about the relationship that I have with that person, of how far I can really dive in. A stranger off the street, it's situations like this, these podcasts and different topics. Hopefully they're hearing me and they'll go behind and say, hey, I want to go check these resources out. And they work. And you'll know, because somebody will tell you. But again, therapy is for you, and I just removed that stigma. Quit telling the world. You don't have to get on Instagram and put a banner. Hey, I went to therapy last night.
Right. Yeah. Right.
You don't have to do that.
Right.
We really don't want to know.
Right.
If you, I mean,
but even if it does come out, again, the whole idea is removing the stigma and normalizing it.
Right.
So if you don't want to shout it from the rooftops, fine. If you do want to shout it from the rooftops, it should be perfectly fine. And I kind of liken it to, what they tell you. You said, you keep saying therapy is for yourself. That is so dead on. But it's almost like, when you're on the plane and they talk about the cabin, and if it gets depressurized, you take off the oxygen mask and you put it on yourself. Before you can really help somebody else or show up in a relationship as your true authentic self, whether that be relationship with your spouse, with your brother, with your friend, with your child, you really have to put that oxygen mask on yourself and really explore the things that are keeping you from being the best you and sort of holding you back. And so I think I love the fact that you keep saying that therapy is for you.
Okay.
It is. I think therapy should really start in elementary school. You know,
we have
I really think it should start in the school system. You know, just what the kids face today, they don't understand conflict, and it shows. You know, and what's going on. You know, I am a 20-year back Baltimore City school teacher, and just dealing with that. You know, it was trauma for the kids, but heck, it was trauma for me, just dealing with their trauma. You know, as well. You know.
Yeah. Okay. Yeah. And we don't have enough mental health counselors in school. Unfortunately, they're being taken out because there's not enough funding for them. So, but you're absolutely right.
We have a question coming from Greg Wells. Mark, how did you go about finding the Black male therapist you knew you needed?
Woo! I'm resourceful, and everybody isn't. But the Boris Lawrence Henson Foundation, I use them. I did Psychology Today. Actually, my son's mother is a licensed therapist, so that was she couldn't counsel me, conflict of interest, of course, but she knew some resources, and I just knew people who were in the business. You know, if you really want help, you're going to go out and find it. You know, I always tell brothers, you know how to find when them new Jordans are dropping.
That's right.
Finding a therapist is no different. You know, you got to research, you know, but the information, luckily, is out there. Years ago, no one talked about it. You didn't know anything. But now everybody, well, I'm not going to say everybody, but a lot of people are talking about it now. So resources, NAMI is a good tool as well. You know, but it's out there, you know.
Yeah, so that's we don't have that. Yeah, NAMI is what he just said. NAMI. There's also the Black Mental Health Alliance, BMHA. You could find their website. They're great if you're in the local DC, Maryland, Virginia area. They can also point you in the right direction as well. And then I also want to mention too, if you have a primary care physician and you talk with them, they also too can help you find the right resources as well. But yeah, being resourceful, thank you, Mark, is really key. Yeah.
So we have another question. This one comes from Wade Whitfield. Wade asks, or Waddy Whitfield, or Wadey Whitfield. Let's start that. Wade Whitfield. Are there any books you recommend on the subject of Black male mental health?
That's a question for Dr. Mel. I'm going to be honest. I did not. Well, I did pick up one book that was recommended. I'm like, I'm not reading this. I'm going right to the internet. Or I'm calling somebody. So that was not my ministry of picking up a book. You know, my ministry was, I'm going to pick up a phone, and I need to talk to somebody right now. A book didn't give me what I needed, so I can't talk on that. Maybe Dr. Mel can.
I can't, but I will. And I must mention, because in our ad, we mentioned that we were going to have Dr. Delvena Thomas on. Regretfully, she could not join us. She's a fantastic psychiatrist who probably would have the answer to that question. But due to severe thunderstorms where she lives, her internet is out. And so unfortunately, she was not able to join us. But I will ask her, and maybe she can put that in the chat later.
All right.
Right. But the book that I did get was called Black Men in Depression. It's by John Heath. I did start reading it. It was actually pretty good. I read it. Now, I would say that's probably the only book that I perused. Other than that, I really didn't read any books. I was for more of the immediate. Now that I talk more about mental health a little bit, I do a lot of research from discussion with the internet is actually saying, but I kind of stay away from the book, me personally, because it's not giving me the true account of what's going on in the Black male community.
Dr. Mel, you said something, actually, Mark said something earlier about starting to younger for counseling. And we talked about how much trauma we face. Can you speak to how much generational trauma that we face, and what is that called?
Yeah, so I think you're referring to epigenetics, which is the study of how our genes turn on or turn off based on our environment and the experiences that we go through. And that there's been research done that's been shown that if you go through a very traumatic experience, like they looked at Holocaust survivors, they saw that there were certain alterations in their genes, certain ones that are being turned on or turned off, that actually got passed to their offspring, and their offspring were at higher risk for things like obesity, diabetes, PTSD, for example, and heart disease. And so I often say, the Holocaust was terrible, but it only lasted for about 10 or 15 years. If you look at African Americans in this country, people of African descent, we've had that level of trauma throughout being captured in the motherland, throughout slavery, lynching, Jim Crow, over policing, throughout many generations. And so it's no wonder that there are some diseases that we suffer from disproportionately. And because of that, I think, as Mark mentioned, in addition to the childhood traumas that we go through, if we are indeed at increased risk for PTSD, you're absolutely right. Getting counseling earlier is better, because I don't think that this is just because you're at risk for something doesn't mean that it has to manifest, because your current environment also has a role to play, and the things that you can do proactively to actually help to maximize your health make a difference. So even though there might be a history of trauma in your family, it doesn't mean that you are sort of sentenced to a certain outcome.
All right. Well, I think we have come to the end of this segment.
Yeah,
absolutely. Well, I really want to thank you, Mark, from the bottom of my heart, for just being so transparent and being so open and sharing your story and sharing your journey. There were so many things that you touched on that I think will resonate with our audience and will help people who are listening tonight. So thank you so much for being here. Thank you, as always, to my wonderful producers, Miss Lila Mays and Mr. Wayne Bruce. If you could take us to that screen, Wayne, where we could see some of the resources that we've mentioned during the show. We've had the National Suicide Hotline scrolling through, as well as Saving Our Kings, as well as the Boris Henson Foundation. So please, if you need those, they'll be scrolling through. Thank you so much for joining us tonight. I will be on the Russ Parr Morning Show tomorrow morning at 8:50 a.m. And if you don't catch me there, remember, join us next week, 9 o'clock, Facebook and YouTube. And until I see you, be wise, be well, and be health empowered.